Deep abdominal breathing. We are going to start with the deep abdominal breathing. And what I would like you to do is, I would like you to go and lay down somewhere. It can be on a sofa, it can be on the floor, or it can be on a bed. It doesn't really matter. But when you get there, I would like you to concentrate on just deep breathing. Just breathing deeply and notice what happens in your body. You can pause the audio if you would like, and I'll wait here. So, go on. Okay, I'm going to presume and assume you have done that. Now, for someone who has not done any deep breathing exercises, generally what they do is their shoulders rise because they think that their lungs fill and therefore their shoulders should rise. It's just a natural response. It's not anything conscious. It's just what happens. What you may have noticed when you went and laid down was that actually when you take a deep breath, your stomach expands. That's because your diaphragm just expands downward to allow all the air in and out and pushes your stomach outwards. And that's what should happen when we are doing deep breathing. So the deep abdominal breathing is exactly that we are looking for, is for the abdomen to feel first, for the stomach to push out of it first when you get right to the very end of the breath. That your shoulders might rise a bit, but it's about the stomach first. So what I'm going to ask you to do just for a couple of times, and then we'll go through the proper exercise, is just to put your hand or your thumb towards the lower part of your stomach. And I'm talking just below the belly button. Not across the belly button, but just below it. So place your hand, maybe 2 or 3 fingers, or you can also place a thumb below the belly button. And I want you to concentrate on breathing into that area. You can just put a little bit of pressure, not too much, but just a little bit, so you can feel it on your skin and breathe deeply inside the area. Now what I want you to do is simply take 3 deep breaths in. So you're having to really pull, and not so that you're really struggling, but so is much deeper than a normal breath for you, and on breathing into that area. So just do that 3 times. Let's get started. So a nice deep breath in, and then exhale all the way. And then a nice deep breath in, and exhale it out all the way. And one more, one nice deep breath in, into the abdomen, and exhale it all the way. Okay, so now you've got the idea of what it feels like to breathe into that part just below your belly button. Now when we are breathing out, we are going to breathe out all the way. And when I say all the way, I mean properly exhale. And that exhaled breath is what lets everything relax. It just lets everything go. Not only is it getting rid of some carbon dioxide from your body, not only is it getting rid of some rubbish, but it's also allowing everything to relax. So now we are going to do the second deep breathing exercise. So what I want you to do is take a deep breath in and hold to the count of 2. And then breathe out, and again hold to the count of 2. So we are going to do this 3 times. Are you ready? Okay, here we go. So breathing in nice and deeply into your abdomen. Hold. 1, 2. And then exhale now. Push the air out. Let it go all the way out. And then again hold 1, 2. Then breathing in nicely, deeply into your abdomen. And then again hold 1, 2. And then exhaling, pushing that area all the way. And hold 1, 2. And one more, breathing in all the way into your abdomen. Hold 1, 2. And then breathing out all the way, pushing the air out. Hold 1, 2. Awesome. Now how does that feel so far? So for some people, they might get a little bit lightheaded because what we are doing is we are oxygenating in the body properly. That's not a problem if you get lightheaded. If you need to stop, by all means stop. But if you want to keep going, that's fine too. So what we are doing, as I say, is oxygenating the body, but we are also giving the body a direct command that we want to relax. So we want to let go. It can just let everything go on. We are going to clean our system out. We're going to clean all the oxygen now because we have loads of it. So that's what we are doing now. We are going to do a 2-minute, so roughly 2 minutes exercise. I'm not going to time it. We are going to do 10 breaths. So just like we have done in the first exercise, 10 deep inhale and then deep exhales. And then once we have done the 10, we're just going to go back to a normal breathing pattern, but still focused on the abdomen area. But this time we are just going to breathe in a little bit deeper than you normally would, and also breathe out a little bit deeper than you normally would. So just to confirm again, we are going to do 10 deep breathing breaths. So really deep into the abdomen area. If you want, you can even breathe in through your mouth and breathe out through your nose and mouth both. If you want to keep your hand below your belly button or maybe your thumb, you can do that. But if you feel you know where to breathe and you know where to focus, then you can just lay your hand at rest. So again, 10 proper exhales where you are sending everything out. You can exhale again through your mouth if you want to. And then we are just going to settle in to that nice deep breathing. Okay? And also there's no need to shut your eyes at this point. We'll do that during the meditation. Okay, so let's get started. Now I'm going to do it with you and I'll keep a count as well so that we are counting maybe together and we keep a track of the count. Okay, so here we go. 1, 2, 3, 4, 5, 5, 6, 7, 8, 9, 10. So you might start to feel oxygen go around. You might even start to feel it going to your head. And that's absolutely fine. That's normal. Now just listen to my voice as you settle in to that nice deep breathing rhythm, slightly deeper than you would normally breathe. And at this point, you can close your eyes if you want to, just so that you can focus on that breathing. Just focus on that area just below your belly button again. Put your hand there, or even 2 or 3 fingers, or maybe your thumb, and pressing slowly. Just breathe normally for a couple of minutes. Breathing into the abdomen and breathing out. Breathing in and breathing out. So just for a couple of minutes, breathe normally. But again, focusing onto your abdomen area. Breathing in and breathing out. Breathing in, breathing out. Just notice the sensations in your body as you do that. Notice how your body is now oxygenated. It's got loads of oxygen flowing into the brain. It's got loads of fresh oxygen flowing throughout the blood. You might feel it in your muscles. You might even get a little bit of a cold sweat on, and that's absolutely fine. That's just your body reacting to be improperly oxygenated, and there's no problem with that whatsoever. So just allowing yourself to breathe nice and deeply. We are not going into any sort of meditative state at the moment. We are just breathing and relaxing our bodies now. Our body now knows that we want to relax. Just those 10 breaths has given our body a command that we want to relax at this point. And that's what it's doing. So just as you breathe deeply into the abdomen area and breathe deeply out again, just listening to my voice as you relax down, fully oxygenate in your body. And now I just want you to open your eyes again and come back. Look around the room where you are, and I want you to take a couple of minutes just as this audio ends. Take a couple of minutes just to think about what's going on in your body right now. How does your body feel? Does it feel any different than before? Does it feel relaxed? Does it feel calm? Or maybe it feels energized because it's got some oxygen pumping around it. So just take a couple of minutes, just a pause before you get into doing something else. Take that time just to think about what's going on in your body. And when you're ready to go on to your other tasks, I'll be waiting for you in the next audio. Bye for now.